Wonderful. Well, welcome and thank you for joining us for our very first Juicy Healthy Hour. I am Sasha Romery. I am the Director of Customer Experience here at Juisci, and I am thrilled to be moderating this event today. It was supposed to be David Liu. If he hops on, I will allow him to take over the mic, but we are having, unfortunately, some technical issues, so I am taking his place today. And I am joined today by two leaders in the world of cardiology, Professor Zahi Fayad, who is Professor of Cardiology and Radiology at the Icahn School of Medicine at Mount Sinai in New York, and Dr. Alexandre Gautier, an interventional cardiology with the Groupe Hospitalier Paris Saint-Joseph here in Paris. And today we are going to dive into how AI is transforming everyday cardiology. We'll talk about practical diagnostics, real-life use cases, opportunities, limitations of AI. And after each speaker session, we will have an opportunity for you to share any questions directly in the chat. We will answer them all at the end of our time together. And then I will be able to also share a little bit about what Juisci is and share our exclusive room dedicated to cardiology with you all. I will now hand over the mic to Professor Fayad, who is going to walk us through innovations and insights where AI is taking cardiology today.
Thank you so much. Okay, this is great. Good morning, good afternoon, good evening, wherever you are. And again, it's really a pleasure, and thank you for this invitation to be part of this. I'm super excited about this because I really feel we're at a inflection point here. The field of medicine is being revolutionized in the space of AI. And one of the areas that is most exciting is actually what's happening in cardiovascular disease. So we can have my first slide. So we can, yeah, so the next slide, please. So as I'm going to demonstrate to you, we're witnessing, or we are living a convergence of different technologies coming in together in the space of diagnostic, in the space of data science, and personalized medicine, unlike anything we've seen before. And cardiology is one of the first clinical specialty that is at the center of this, and it's taking and helping, patients with cardiovascular disease. So next slide. Why cardiology? I mean, cardiology because it is one of the practices of medicine where it's really data rich. It's obviously a very mature specialty in medicine. And every day in cardiology clinical care, we generate enormous volume of data. We have high resolution imaging techniques, so we'll talk about that aspect. We have CT imaging, MRI. We deal obviously with physiological signals, with echo and echocardiography. We have video, we have blood markers, and then we obviously have electronic medical record that are longitudinal. And then finally, we've been adopting the use of remote patient monitoring and wearables in a couple of the specialties in cardiology. But until recently, we've only been using the data either in a fractional way or not in a connected way. And now we're at a level where multimodal data integration for clinical practice is critical. So we can move from snapshot to aspect of going into dynamic and following throughout basically the health span or the disease span of a patient. And we've only been able to do this because the tools are now becoming available. And AI is the tool, and with its different versions of AI. I'm not going to get into too much of that technical aspect. I'll be speaking in generality about AI in my presentation. But now we can begin to understand the disease that is dynamic, that is measurable, and is obviously predictive and personalized. So in a way, this is a demonstration in the space of healthcare, and cardiology being one of them that demonstrate the power of AI. I have to say that there are other fields also. I'm also in the area of radiology, where AI is the main tool and it's advancing very much. And then the other areas you probably heard about, maybe anything to do with pattern recognition medicine, like pathology and dermatology. Let's go back now to the promise. So this is my slide here. So I'm going to talk to you about, why is it promising? Because as I said, we're going to be accurate, we're going to be predictive, we're going to be personalized, and we're going to prevent the disease. AI will help us to improve the diagnostic accuracy by extracting these features that are subtle beyond human perception. So that's the aspect of these novel pattern recognition of disease or of diagnostic. We're going to enhance the risk assessment with modeled, trained of millions of patient record. And we're going to generate, obviously, predictive insight to identify the risk before symptoms appear. And then finally, we're going to treat each patient individually. So we have this personalized treatment. We'll give the right intervention at the right time for the right reason. This is not the future. This is what's happening today. Maybe not all of it at the same level, but we are currently practicing this type of cardiology using AI within our daily clinical care. Next slide. Let's start with the example of AI in imaging. In cardiology, imaging is one of the important tools for diagnosis. We have different ways, we do imaging. It could be either echocardiography, CT, MRI, or nuclear. And the importance of that is going to have image acquisition enhancement or improvement. I'll talk to you a little bit without going too much technical on AI-assisted scan planning and parameter optimization, motion and noise reduction during acquisition, and then automated, gating for the ECG for irregular heartbeat, and then real-time quality control. So this is all in ways of how we acquire the data, and then AI is helping us improve that. The other aspect is the aspect of image enhancement. Obviously, most of the imaging techniques, we have limitation in terms of what we call signal to noise. Same thing, if you're an amateur photographer, if you're taking a picture with your iPhone and the light and the contrast is not very good, there are ways that the AI is within your phone is doing enhancement. We can denoise the image. We can use deep learning to remove some artifact. We can create what we call super resolution for sharper imaging. We can create synthetic contrast. So there are many solutions doing this. And then we can look at cross-scanner image standardization. Finally, or the other two ones, in terms of after we have improved the acquisition and speeded up the acquisition or enhanced it, now we need to find disease detection. So this is where we can use multiple post-processing techniques to detect, let's say, plaque in the coronary much better, identify the plaque. We can do left ventricle function estimation that's fully automated, identify, the infarct or the scar, and classify the different cardiomyopathies. A lot of things when we do imaging, the aspect of segmentation becomes very important. So we can segment the different areas in the organs, left ventricle, right ventricle, vessels, and all this helps us again in terms of doing better assessment of the imaging that is now also being done in a much faster way. So instead of taking hours to process the data, now we can do this within minutes. Next. So now let's talk about, give you some example about automated quantification. So these are, a few examples from the literature. This is from Miller et al., Nature Communication 2024, where we are using AI-derived cardiac volume and cardiac calcification quantification. This is now done on low dose, even CT images. We're able to extract these extra features and then do a full assessment of both the myocardium as well as the vasculature. The other one is an example by Buva et al., Circulation Imaging 2019. This is with cardiac MR to speed up the segmentation of the left ventricle, and this is done now. And instead of doing manually, now we can use neural networks to try to speed this. So let me just, in terms of usually an expert will take 12 minutes. A trainee, let's say, will take 13 minutes, but the neural net is now doing it in 7 seconds. I mean, that's incredible, right? To be able to speed things up in this way. Next, so beyond the segmentation, now what I call recovering signal or from a noisy images, that is going to help us to do, let's say, faster imaging now. So I can take a lower resolution image, but now I can recover the signal and make it look like higher resolution. There are many packages today, software that we have add on to our imaging systems that do this. They use what we call deep learning reconstruction that leads to faster imaging, but also enhanced imaging and improved, obviously, productivity. This is very helpful for the technician, but also very helpful for the physician that are doing these kind of repetitive also tasks, but also helping the aspect of denoising. This example here showing for fetal cardiac MR. So now we're looking at cardiac images, within pregnant during pregnancy, and then we can measure now the fetal cardiac MRI because we're able to enhance the pictures using deep learning. Next, I've touched a little bit on this. This is more related to motion correction. So when we have, obviously, coronary imaging, there's motion of the coronary. If let's say the heart rate is irregular or beating fast, you're not able to slow down with beta blocking, then the image is going to be noisy, or sorry, it's going to have motion artifacts. So you can correct for these motion artifacts in these angiogram by, again, using deep learning methodology, and that will help sharpen the images of the coronary artery. Next, one big emphasis today, beyond the quality of the image or speeding, is really the workflow. That's probably one of the areas that there's a huge emphasis on today, is the day-to-day workflow. We need not only help in terms of scheduling and selecting the right imaging protocol for the study, but as I said, we have faster imaging, improved safety, enhanced productivity, and increased throughput. This is becoming probably one of the most important aspects, especially also as the images become, they take a long time to, let's say, to acquire. We don't have enough technologists that do the work. We don't have enough workforce, and this is all going to help get people in and out of the from the clinical care much faster. So I think we're seeing a lot of work in this area. It goes beyond, in a way, the practice of medicine as a physician, but it's more of the business of running, a clinical system. Next, in cardiology, we've adopted the use of remote patient monitoring. In different manners. We're looking at the use of tracking and monitoring devices with smartwatching. There's a very popular fitness trackers available, health sensor that collect biometric data, and then even there's augmented reality, virtual reality related to, let's say, cardiac surgery, etc. So this field is moving, very fast, and it's being adopted, not in its entirety. I think this is early on and early days, but there's more and more integration of wearables, and obviously the AI is helping a lot, in a sense, processing the data, and then creating the next slide, creating in a way dashboards, from patient to doctors, and for patient that can look the next, yeah. And that's helpful in a way, in cases of people that have, let's say, no, sorry, the one. Let me go. Oh, yeah. So, as I mentioned, we use the wearable. We want to detect, let's say, some kind of an event, maybe related to an arrhythmia, related, let's say, somebody with heart failure, and then the AI is obviously helping, figure out with the right algorithm, and then create an event alert. Next slide. No. We're looking at data integration, goes from the patient to a wearable that measures blood pressure, measure an ECG, do some integration, and then put together some dashboarding. The dashboarding is important for, let's say, the clinical team to look at, but also for the patient to monitor themselves. And then, as I said, we have ways to create, let's say, actionable picture from the data, and AI is basically acting like a conductor of harmonizing the data from these different wearables. Next. But we have things also that we need, better work. So that we, going beyond traditional metric that I have mentioned that we use every day, such as ejection fractions. AI is helping us now find better ways to figure out what is the strain or mechanical function of the heart, what is the myocardial work, what are the different hemodynamic patterns. So we are starting to, because we are data rich now, we have multidimensional measure, and these are all starting to be integrated to get a not what I call maybe novel markers or novel metrics or novel biomarkers that were not available before, and these again are helping in the guidance and of therapy, but also understanding the dynamic of the physiology. Next. We spoke about pattern recognition. I mean, pattern recognition is helpful to analyze existing images, maybe recognize certain markers that can be processed fast, but let's say recognize new markers. And then eventually we're getting into the space where now we're starting to recognize and connect the dots, to create, maps of these complex patterns, maybe create a new classification of these anomalies. And then eventually, these are being helpful to detect disease before it's really prominent. And that, I think, is where the biggest promise of AI in terms of medicine is the aspect of leading to this early detection. And that's shifting really the curve now from treatment to true prevention. Next. And I said this at the beginning. I mean, we are today practicing medicine in a very multimodal way. And that's why we need AI to help integrate the data. We are not only relying on the vital signs or some one imaging test. We are combining now this data that's very rich. It has different scales. It comes at different temporal resolution or even spatial resolution. But the integration of the data that is available either in the AHR or available because you've done a CT or an MRI or an echo, but also now because you are equipped with a wearable, will give us a way to do this comprehensive monitoring and do this holistic assessment. Next. So this will get us really into moving away from relying on, let's say, Framingham score, which is a well-validated calculator, but it is limited by averages. Same thing with the ESCVD. ESCVD is not ideal, and it does not always capture and is not always well calibrated and discriminative. So now with AI, by integrating the data, we have better calibration. We can create discrimination, but that's more accurate, and create an advanced risk model that is personalized. And that will help us, obviously, be more predictive, but also get into the space of prevention next. I've talked about this before, but I want to go back to this, and because I do think most of the important research is happening now in this area, where you have a good assessment of the health of the patient. You are using CT, MRI, echo, or nuclear as an imaging tool. You have all the medical history in the EHR that you've collected, and then you have done a battery of imaging, of blood testing at different scales. But right now, I mean, the physician has to, if it's not aided by AI, the physician is trying to integrate within their head, these different signals, and they may be missing things. So when we can integrate this multimodal data, we create, this risk score, and this risk score, it is the one that is going to guide us to create a treatment plan or a prevention plan for the patient. Next. Design support is becoming also, it's something that it's now becoming more and more integrated for the patient care. So this way we are, mean that we can now support clinical decision making in real time. You can imagine AI that, given a patient, again, imaging labs, wearable, can tell you, based on this trajectory, this person now has a likelihood of heart failure in the next 6 months. Or they're unlikely to respond to this therapy, but may benefit from another. I mean, this level of insight will get us to the true individualized treatment and smarter resource allocation, and get us to this evidence-based personalized medicine, immediately. Next. So what we are, we discussed so far, and much what I discussed today is that we have validation, and we have tools in image reconstruction and segmentation that is fully implemented today, and more will be used, and this will change the workflow, change even the imaging protocol that makes them faster and more both technologically and user friendly. We will get into this workflow of triaging, and so, for example, this will prioritize, what kind of, let's say, urgent studies or urgent scans or urgent measurement that needs to be done. And now we are also seeing more and more wearables that can give us information on the patient, let's say, physiology, 24 hours. Next. So the emerging needs are basically, these are areas that are coming soon. I didn't talk a lot about the digital twin, but digital twin is when you take now this data on individualized setup on basically on a personalized manner, and then you update that information in real time, and you create in silico a computer model of the patient, which means that now you're able to interrogate and figure out the best course of action on this patient, because now you can, the recommendation, you can do all kind of simulation to create recommendation for the subject. We also have, closed loop therapy adjustment, because now we can monitor things in real time, and we can create, let's say, algorithm that guide, let's say, titration of medication automatically. And then finally, we will create soon these healthcare grade generative AI that are capable of simulating pathologies or therapy outcome for both planning and education. These tools are not ready yet, but these tools, are up and coming, will help, redefine not only the diagnosis, but how we manage, health over the lifetime. Next. So, the closing, basically the road ahead, so my one reflection I have is when we talk about AI in cardiology, is not about, algorithm. It's really about amplifying the physician insight. The physician does not disappear. The physician actually gets augmented and evolves. We move from being really data collectors to interpreters, from reactive responders to proactive guide of health span. And our task now is really to ensure that these technologies are safe, they're validated, they're equitable, and they are basically benefiting, everyone. So if we do that, AI will help us achieve something that is extremely profound. It is going to change, the practice of medicine in the next couple of years. So I'm really excited about this, and I'm happy to take questions now, or we take them later. I was not sure about this.
If you have any questions, you can pop them right into the chat, and Professor Fayad will answer them during our Q&A session at the end.
Thank you so much.
Thank you so much, Professor Fayad, for that amazing presentation and for your time. It was really a pleasure having you here and hearing you speak and learning from you. And now I would like to invite Dr. Gautier to share a little bit about practical AI, what's working and maybe what's not working in everyday cardiology.
Okay, thank you. Hello, everyone. Many thanks to the Juisci team for organizing this webinar. It's a pleasure to be here to discuss AI revolution in the field of interventional cardiology. Can you finish my slide, please?
Yep.
Okay, thank you. So, okay, I'm going to give you a brief overview of the AI integrated tools we currently use in our cath labs and describe how our practice may evolve in the coming years. Sorry. So as an interventional cardiologist, I view AI as a tool to improve clinical decision-making, pre-interventional planning, and optimize device selection and implantations. And of course, the ultimate goal is to improve our patients' clinical outcomes. So to begin, the first area of application is, of course, coronary artery disease, which represents the majority of our practice. And as you know, the visual interpretations of coronary angiograms can sometimes vary from operator to another, which can have a significant impact on diagnosis and treatment decisions. And coronary angiography recognition system using a deep neural network are currently being developed to automatically recognize not only all the coronary segment, but also detect lesion morphology with a level of precision surpassing that of the human eye. And like any other imaging technique, AI therefore has the potential to enhance the reproducibility and accuracy of coronary angiogram analysis and to save time through automatic report generation. Now let's move on to intracoronary imaging, a very useful and highly recommended tool for performing complex percutaneous coronary interventions. Two technologies are currently available, optical current tomography and intravascular ultrasound. And these techniques allow for precise study of the lesion to be treated, specifying the plaque composition, vessel diameter, and the lesion length, which helps the operator choose the appropriate PCI strategy and the stent sizing. The intracoronary imaging also makes it possible to check whether the stent is correctly implanted and, if necessary, to perform an additional intervention to optimize the result. Despite a strong guideline recommendations for complex PCI, its use in daily practice remains limited by several factors: time-consuming manual analysis, operator-dependent variability, and high cost. AI integrated can already provide us with useful information to guide PCI. In particular, it can automatically identify the calcium burden of coronary plaque, the external elastic membrane, and malapposition of stent after PCI. And the integration of AI in intracoronary imaging is constantly evolving with the aim to improving the accuracy of lesion analysis, facilitating workflow, and thus increasing its adoption in routine PCI to ultimately improve patients' outcome. So let's now look some application of AI in transcatheter aortic valve replacement. As you know, the pre-interventional CT assessment is essential for pre-TAVR planning to validate feasibility and identify risk of complications, especially in complex anatomies. But current methods for image analysis are time-consuming and subject to inter-operator variability. Therefore, many AI-based tools are being developed to facilitate pre-TAVR CT with the aim of automating image analysis, improving procedural planning, and predicting post-TAVR outcome. For example, here is a model using a fully automated deep learning algorithm for pre-TAVR CT scan, specifically trained with complex aortic valve anatomy. And compared to experienced operators, AI achieved excellent performance in determining all parameters necessary for TAVI planning, such as annulus plane, coronary osseous height, and calcification volume factors. So this type of integrated AI is therefore very promising for enabling rapid and reliable assessment for pre-TAVR, with an accuracy comparable to that of experienced physicians. Cardiac CD data can also be used to simulate a structural heart procedure with virtual device implantations to assist the operator in choosing the type and size of prosthesis. This is what we call a digital twin. Here is an example of patient-specific simulations that allows the visualization of the interaction between different transcatheter heart valve devices and the patient's anatomies. This allows estimation of the risk of coronary obstruction, annular stretching, and annular rupture, especially in cases of protruding calcification, as well as residual paraprosthetic leakage and post-TAVR pressure gradient. The digital twin technology also exists for planning transcatheter left atrial appendage closure. And now I need the video, please. Okay, now for example, here you can see a 3D reconstruction of the left atrium and the atrial appendage. Also shown are the transseptal puncture area, the ostium, and the landing zone plane, as well as the mitral annulus. And the implantations of different sizes of prosthesis with different implantation depth can then be simulated. So you can see the switch between the size and depth of implantations, and the model can generate information on device compression and wall appositions to predict the risk of peridevice leakage. And so, can you go back to my slide, please? Thank you, Doc. So this AI-enabled CT-based computer modeling was evaluated in a randomized control trial that shows added values of this technology in improving procedural outcome with a fewer different prostheses needed, fewer recapture during implantation, fewer contrast agent, and fewer X-ray. Okay, so next slide. And to finish, finally, I want to talk about wearable-assisted procedure already being used in some centers to perform percutaneous coronary intervention, and are expected to expand in the coming year, particularly in the field of transcatheter heart valve procedure. The implementations of AI in these robotic systems will certainly be a topic of debate within the cardiology community. So to conclude, here is a quote from Professor James Howard in an excellent editorial, which I think perfectly sums up the potential of artificial intelligence for professions. Given this exciting advance, it may be that in 20 years we will not be asking about AI's role in the cath lab, but rather as a cardiologist. Thank you very much.
Thank you so much, Dr. Gautier. If anyone has any questions from Dr. Gautier's presentation or any questions directly for him, don't hesitate to pop those in the chat and we will answer them during our Q&A session at the end. Two very informative presentations that we have had so far, and now I am delighted to be able to share a little bit about Juisci, who is hosting this webinar today, and give you a little bit of a demo of our dedicated room in structural heart disease and cardiology. So I'm going to share, let's see. Let me share my screen real quick. Here we go. Okay, perfect. So Juisci is a free AI-powered tool used by over 200,000 healthcare professionals worldwide. Continuing medical education is paramount for you as healthcare professionals, and with Juisci, you can leverage AI to help you save time and stay up to date with the most relevant and impactful publications in cardiology. Juisci helps you automatically fetch, curate, and summarize the latest publications. It also turns complex research into short, easy-to-digest formats like summaries, podcasts, videos. And finally, it offers personalized rooms and recommendations so that each of you can focus on what truly matters to your practice. Juisci is an independent and unbiased application built to serve healthcare professionals like you first. And thanks to the support of Edwards Life Sciences, we have launched a dedicated cardiology room where you can explore even deeper into the world of structural heart disease, while keeping everything objective, neutral, and diverse. So the structural heart disease room brings together the most relevant publications for both interventional and general cardiologists. And the QR code that I have on the screen right now will bring you into your designated app store on your phone. You can scan it directly from your phone, and it will allow you to download the app and follow along live with my demo. When you do scan the QR code, it will lead you directly to your app store on your phone, whether it's the Google Play or the App Store, and you'll be able to download the app. And then once you've downloaded the app, you can return to your camera application and scan this second invitation code that will allow you to join the exclusive room in structural heart disease. The QR code will bring you to this login page, and if you are new to Juisci, you can scroll down and tap the pink Register Now button. This will lead you to the registration page, and here you'll be able to put in your basic contact information, including your name, your email, etc., country of residence. Assign yourself a password, and then don't forget to check the button at the bottom that confirms that you accept the terms and conditions, and then tap on next. And so while you're doing that, I can remind you that Juisci is a completely free application. We are GDPR compliant. We will not fill your inbox with communications. Our goal is really to help you save time and staying up to date with the latest scientific literature in cardiology, leveraging artificial intelligence to do so. The app will then ask you to select a profession as well as a main specialty. This will help personalize the content in the app for you based on your preferences. Cardiology should be pre-selected for ease, but we also have interventional cardiology as an option for you as well. Once you click next, then Edwards will ask you if you want to stay informed with key publications that might interest you. I will say yes to keep me posted, and here you are, we are in. So now we can dive right into the app. First, let's have a look at the discovery page. This is the landing page where you can see all of the latest research and publications in structural heart disease. Think of it kind of like your news feed of the latest medical research, where each card is a unique publication. As you scroll down, you'll be able to see more publications shown in chronological order from most recent to less recent. Now I want to show you something really powerful. Here you can filter articles based on your interests and subspecialties within the world of structural heart. Simply tap on the filters button on the top left corner, and let's say I want to see articles on aortic stenosis or aortic valve replacement topics. So I've selected those. And here you'll see that I only have articles related to these categories. So really, really useful if I really want to filter down the areas that are of most interest to me. So now we can scroll back to the top and I can show you some playlists. At the top of the discovery page, you might have already seen it, you can find a series of playlists, which are a great tool for bringing together several relevant articles under a single theme or topic. If you select See All, you'll be able to see all of the playlists currently hosted in the room. And so here, for example, this playlist, AI in ECG from risk prediction to diagnosis, you'll be able to discover pre-selected publications around this particular topic. Each publication digest starts with the conclusion and then otherwise follows the same format as the original publication. When you're commuting or on the go, you can listen to it in the form of our text-to-speech feature. And as you can see, we will follow the same format as the original publication through to the key figures, and it is always source tracked to the full original publication at the bottom. Now, by clicking the three dots on the top right corner, you can share this entire playlist with your peers and allow them to be able to discover that content as well. Even if they don't have Juisci yet, they'll be able to discover it, click through, and decide to download it on their own as well. So now let's have a look at the For You page. This is a page dedicated to you. How does it work? So basically, this page will push content that is highly relevant to your unique profile. This content is based on your preferences, your reading habits, your interactions with the content in the app. You have the option to save articles directly into one of your personalized playlists wherever you go in the app. So let's say, for example, I want to save this article. I can tap those three dots and create my own new playlist. You can give it a name, keep it organized. So let's say I wanted to create this playlist here to be able to group all of these publications under one topic. And maybe I want to add another article to this particular playlist. So we can go and select one, let's say maybe this one here. And then I can add it to that playlist, and there it is. So now let's dive into another page in the room, the search page. This is the perfect place for us to, there we go. This is the perfect place for us to conduct any specific research if you have a kind of a clear, specific idea of the articles and publications that you want to see. I typed in heart failure, and I can scroll through all of these publications to see which one I'm particularly interested in. You can also do that with authors' names or even search for journals. For example, if I wanted to look up the European Heart Journal in particular, I can find it directly here. I can go to its dedicated page to see all of the latest publications from this journal, but I can also follow the journal and make sure that I am notified and can access the latest relevant article from the European Heart Journal specifically. So now I want to show you one of our most favorite tools. It's called Juisci GPT. To be able to access it, you need to go into our public room, exit the structural heart room by clicking the home screen on the top right or top left corner. Juisci GPT is our AI chatbot, which is specifically trained on high quality medical literature to provide evidence-based answers to medical questions. Juisci GPT offers concise, source-tracked responses to complex queries, all with sourcing directly within the app for transparency. As you can see, the answer came up in minutes or in seconds, and all of the sources can be found at the bottom. If you want to check out the full article, you can scroll all the way to the bottom, and it will always redirect you to the original publication. So now that we have done that, we can walk through our final page, which is the profile page. We can bring you back into our app over here and check out our profile. This is where you'll be able to find all the contents that we saved earlier in our library. So here's the playlist that I just created a few minutes ago with all of the articles that I saved directly inside. So Juisci is just one example of all of the ways that AI can boost your productivity as cardiologists. The AI curates and digests all of the publications, and there is always an internal medical team on our side that does a final human validation to make sure that the publications remain relevant and impactful for us as cardiologists in our daily practice. Having these complex and lengthy publications in concise bullet point format as well as audio format can really help you to not only stay up to date, but also to assimilate the research better and faster in your already very, very busy days. And now I can stop sharing, or maybe I can leave that up for a little bit to make sure that everyone has the chance to scan and explore. And I can open up for our last 12 minutes for questions. Professor Fayad and Dr. Gautier, are you ready? Perfect.
Already.
Wonderful. Okay, so our first question, I believe this one is for you, Professor Fayad. Have you heard, or actually it could be for either of you, have you heard of any promising AI technologies for antenatal and postnatal diagnosis of congenital heart disease? Is there any that you think have the most promise?
Specifically for congenital heart disease?
That was a question.
Yeah, I don't know about something specific. I can assume, obviously with congenital heart disease, these are complex cases. We perform imaging sometimes in a non-standard way because of the complexity of the anatomy, for example. So we, the tools we have, let's say for segmentation or recognizing these different anomalies, you will need a specifically trained data set. So I assume that these are available or will be available. And there's also aspect that I can imagine, especially for congenital heart disease, the aspect of, let's say, unusual physiological signals that we, so they will have to have a, very specialized, software and data set for training. Yeah. But I can see that, I can obviously see the need for it. I'm not in the area of congenital cardiovascular disease, so I cannot tell you of a specific software, but I can imagine that there's activity in that area. Yeah.
Wonderful, thank you. Anita asks which AI tool that you recommend for creating risk stratification scores.
So this would be for me also?
Probably, yeah. I'm going in order, so they probably are for you at first. I'll skip around after this one.
I mean, in terms of, I mean, tool-wise, it all depends what you mean by the word tool. I mean, we use different models that either are available or they are modified model. But right now, we're relying a lot of the Gen AI type of models that we modify. And so it all depends on what kind of risk calculator are you looking for. So yeah, that's another answer without knowing exactly the detail of the question. Yeah.
Perfect. All right, let's see. Athen has two questions. One is, what AI model so far performs the best accuracy? This is a wide open question, so I could see what you both say about this one.
So do you want to take it?
No, I think you have better learning to the specific AI model. I'm not very AI specialist.
Okay. No, so again, it all depends what it is. I mean, we have been using a combination of models to build, let's say, a segmentation tool from MRI and CT data. So there's Llama in there. There's a whole combination of the existing models that we modify for our training. And again, a lot of the stuff we're doing today, because we're working a lot on workflow. So a lot of it is building on top of, let's say, generative AI tools that are available.
And a follow-up from that, if the accuracy is 95%, how do you deal with the remaining 5%?
Yeah, that's why that's why we have. The bar is very high in healthcare, and if you are looking for a diagnosis of a certain thing, 95%, in some cases may be enough. But again, I believe in multimodal data, which means you have imaging AI tools. They give you certain things, but you need to use some other ones on top of it. Let's say some blood marker, etc., which will improve the accuracy. Yeah. It has to be really domain specific. What we're looking at. Yeah.
Perfect. Thank you. The use of AI, especially in cardiac imaging, can we say that this can help in the area of cardiac diagnostics in developing countries with less infrastructures?
Absolutely. Yeah. This is, again, where I go back to that workflow. And we have deployed, some of these tools in areas that they don't have expertise in cardiac, let's say MRI. MRI is very difficult. And we created these tools to help the technologists set things up. They may not have a lot of experience, but the algorithm or the software will guide them into the process. So that's in terms of acquisition, but also it helps a lot in terms of the reading. So deployment of these tools to help somebody who may not have seen, let's say, 10,000 cases throughout their clinical practice. So deployment of these in areas where there are not as much training and education is definitely helpful. That's how you democratize, in a way, the tools. Yeah.
Yeah, for sure. That's a great question. This is an interesting one. What do you think about self-cardiac evaluation? So kind of EKG, cardiac ultrasound by the patient guided by AI?
Yeah, that's a big thing. And I believe, that more and more now we know that the patient are trying to be very proactive themselves. But there's obviously a risk of creating maybe unnecessary or missed, or overdiagnosing something. So that's where the dilemma is, or the elephant in the room. I think more information is always good, but you also have to be careful that now suddenly, I mean, that's why you go to medical school. That's why you train. That's why you see cases. I mean, we're still going to need a physician. But I think things, collecting data continuously at home is useful. But that needs to be, you're not going to be a cardiologist yourself at home. You're going to, hopefully provide that data to somebody who knows how to do the interpretation and help you through the process.
Sounds to me like that could be something that would really elevate the conversations with cardiologists.
Exactly. Apple introduced the blood pressure warning. So it doesn't mean that just going to say, okay, you reach a certain threshold, you go get some further testing. That's going to happen. But now, I wouldn't say, at home now, I have now an Apple Watch, or I have, the point of care ultrasound. You think, ultrasound is very hard to do. You need training. But no, you think that suddenly now you're going to start looking at your heart yourself and call in disease or not. That's maybe a little bit of an overreach, I should say.
Here's an interesting one. Charlie is interested in AI ECG interpretation and what we're starting to hear about this being developed in veterinary cardiology. How much is this being used in human cardiology so far, if at all? And he's talking full 6 or 12 lead ECG rather than wearables.
Correct. Yeah. So I don't know about the veterinary aspect, but in terms of human aspect, yes. I have a PhD student, MD PhD student working on even one lead ECG. So substituting a 12 lead ECG with a wearable that is as accurate as the 12 lead. I think we are going to be able to do this soon. So that will again simplify the aspect of the acquisition, and this is something that you could do at home, but you still need that sign off. So the AI could do the interpretation. The AI will help in the acquisition. The AI will help it, but you still need a doctor to sign off. excuse me, on the result.
Perfect. I think that was the answer to this final question here, which is, can AI actually diagnose patients in the long term, and what would be the role of the cardiologist then? But it sounds like cardiologists will still be there.
The physicians is going to be there, will not be replaced, but the practice of medicine will change. I think we're going to get more into the aspect, what we call, the cerebral aspect of the physician, that now the AI is going to help them. It's going to help them, against burnout. It's going to help them recognize certain patterns, because let's say today, I had a bad night and I'm not as sharp. So the AI is going to, hey, it doesn't look like you're too sharp today. I'll help you. So augmenting that. So it's really going to be a tool for augmentation, but not for replacement.
Wonderful. Thank you both so much for your time today. It was really, really wonderful having this conversation. Do either of you have any final remarks?
No, we're excited about AI for all its application, and also your application, also knowledge based. We are flooded by knowledge today, and the idea is that how can extract the right knowledge for us to make it also in real time decision, real time practice. So this is what you're doing is on top of what AI can do in diagnosis, and getting the right information in the right way is very helpful. So thank you for that.
Thank you. Wonderful. Well, thank you both so much. I wish you a very wonderful day and evening. And thank you to all of those who attended today. It was really, really lovely having you here for our very first Juisci Healthy Hour. and looking forward to seeing you again at the next one.
Same here. Thank you again.
Thank you very much.